Tiến Thành xin chào quý vị đến với talk show ngày hôm nay, trưa thứ ba với tổ hợp luật sư Acres. Thì như thường lệ hôm nay chúng tôi có hai vị luật sư đến từ công ty tổ hợp luật sư Acres là luật sư Michael và Tyler, và có thêm sự hiện diện của bác sĩ Sunavo, bác sĩ chuyên về làm giảm đau này, về thương tích, về đau hoặc là xương sống. Thì chủ đề ngày hôm nay sẽ là về thương tích cá nhân và những cách mà điều trị vết thương, điều trị đau. Rồi, hi all, how are you today?
Good. How's it going?
Good. So we have someone on Zoom today, our guest speaker.
Yes, we have Dr. Dasgupta joining us from Premier Pain and Spine.
Yeah.
All right. Hi, Dr. Dasgupta. How are you today?
Hi, I'm doing great. Thanks for having me on the show.
Thanks for joining the show today. First of all, can you introduce about yourself to our viewers?
Sure. My name is Dr. Sanava Dasgupta. I'm an anesthesiologist, but I've done subspecialty training in a specialized field called interventional pain management. So what we do is treat a variety of chronic and acute pain conditions for our patients, trying to help them get back to a better quality of life.
Alright. Thì thưa quý vị, hôm nay có bác sĩ Dasgupta đây là đến từ công ty Premier Pain and Spine, cũng là một cái công ty chuyên về điều trị, một cái hệ thống chuyên về điều trị vết thương này, làm giảm đau này, và chuyên ngành của bác sĩ là ngoài những vết thương bình thường thì còn có về điều trị về cái xương sống nữa. Rồi thì bác sĩ là có bằng, cũng như bằng license là physician ở bang Illinois mình. Rồi chúng ta cùng đi tìm hiểu về những cái xung quanh những cái vấn đề về y tế này nhé. Alright, I think let's go into our Q&A session today.
Yep, that sounds good. So, Doctor, if you could tell us your role at Premier Pain and Spine and what you do to treat patients there.
Sure. So I'm actually one of the founding partners of Premier Pain and Spine. We started the practice about 11 years ago in the Chicago area. So we went from basically one office in the back of a hospital and then quickly expanded to 5 locations now. So, it's been a real pleasure to see it grow and serve the community and be able to treat so many patients. It's really just been a blessing, to be honest. My role at the company is I work clinically, so I have my own book of patients that I see and I treat. And I'm also responsible for just a day-to-day running and operations of the company as well. So I'm handling everything from the nuts and bolts type of stuff all the way to strategic planning and vision of the company. But definitely my favorite part is still continuing to treat all our wonderful patients throughout the Chicago area.
Đấy, thì thưa quý vị, một chút về vai trò của bác sĩ ở công ty Premier Pain and Spine PPS. Thì bác sĩ là giám đốc, cũng là người điều hành công ty này. Thì công ty gọi như là phòng khám này, phòng khám chuyên về điều trị giảm đau và thương tích về xương. Thì đây là những cái bệnh viện bác sĩ có lâu năm kinh nghiệm và vận hành cái văn phòng này về vấn đề về thương tích bầm hay gì đấy, hoặc là bị thương tích trong về xương.
And before Taylor jumps on to her next question, can you tell us where the locations are and how many people are part of Premier Pain and Spine?
Sure, yeah. So we have office in Schaumburg, in Downers Grove, in Berwyn, downtown Chicago, and then we staff some offices in Elk Grove Village area as well. We have on part of our practice, as part of our practice, we have 5 physicians currently as part of our practice. We have physician assistants as well, and about 30 support staff between all offices to help everything run smoothly.
Thì thưa quý vị, nói về công ty PPS thì tôi có những bác sĩ, có những cái chi nhánh ở những xung quanh những cái suburb, những cái địa phương và gần Chicago này, khoảng 5 địa điểm, và hiện tại là có khoảng 5 người bác sĩ làm trực tiếp đi điều trị cho quý vị.
Doctor, what education and training did you go through to become a pain management physician?
Sure. Good question. It was quite a bit. So after college, you have to go to medical school. So that was a 4-year process to finally graduate from medical school with your MD. Then Once you're done with medical school, you enter into whatever subspecialty of medicine you chose. So that could be, if you wanted to do family medicine or internal medicine or surgery, you would enter into that residency training directly after medical school. So I chose anesthesia as my residency training. So I went out to Philadelphia for that at the University of Pennsylvania, and that residency is 4 years long. After that's completed, you can choose to practice as a general anesthesiologist, but during my anesthesia residency, I got some exposure to interventional pain management during residency, and I loved it. I loved, being able to treat patients coming in with acute pain, doing a procedure, or your pain they've been suffering with for years, and doing a simple procedure to alleviate their symptoms, watching them walk out of the clinic happy. I thought it was amazing. So I knew then that that's what I wanted to do. That required a additional 1 year, what we call a fellowship. So that's an additional year of training even past your residency. So that all in, I was about 9 years into training. And then finally, when you finish your fellowship, that's when you are technically allowed to go out and practice your profession. Obviously, if you pass all your board exams, which I did. And my first job, if you will, right out of fellowship was actually starting Premier Pain and Spine. And that's what I've been doing since then.
Thì thưa quý vị, những cái mà câu hỏi vừa đặt ra cho bác sĩ ở đây là những cái giáo dục và những cái training, những cái gì mà mình cần thiết để mà trở thành một cái người bác sĩ đi điều trị về vết thương, điều trị về đau. Thì cái con đường mà nhìn chung phổ biến nhất cũng đã là thường là học lên trường y học của medical school. Thưa quý vị, sau khi tốt nghiệp thì lên med school, sau đấy thì học đi chuyên ngành, học xong khoảng tầm 4-5 năm ấy, thì mình đi vào những cái chuyên ngành thì bác sĩ có mặt tại đây là Gupta, thì bác sĩ là chuyên ngành về là gây mê, và sau đấy là chuyển sang những cái lĩnh vực chuyên môn hiện tại đang làm là về vết thương và điều trị về xương sống. Right. So my follow-up question for you is, can you describe the PPS core strategy and missions?
Yeah. So our core strategy and mission of the company is we like to use a multidisciplinary approach to help treat and alleviate chronic pain for our patients, helping them to achieve a much better quality of life, and if possible, get them to as much of a pain-free life as possible. And by multidisciplinary, I mean we like to use not only procedures, but physical therapy. We like to use biofeedback, cognitive behavioral therapy, whatever tools and means we have possible at our disposal. We'll use every cutting edge technology possible to try to improve patients' quality of life. Typically, we will write medication for patients. Some patients need medications, but we've always tried to reduce or keep the amount of pain medication that patients are on as low as possible. We know for certain that high amounts of pain medication don't help people achieve a quality of life that's substantial in the long run. So, we really try to utilize these other pillars of pain management in helping people achieve a higher quality of life and alleviating the burden of chronic pain.
Right, thank you. Quý vị thành vừa đặt câu hỏi cho bác sĩ ở đây là những cái mà sứ mệnh cũng như cái giá trị cốt lõi của công ty Luật, công ty của cái bệnh viện, phòng khám đa khoa, phòng khám này của bác sĩ là gì? Thì bác sĩ vừa đề cập là cũng là dùng những cái chuyên môn được đào tạo lâu năm, hành nghề, cũng có bằng cấp, cũng có được cấp chứng chỉ, và những cái công nghệ cao tiên tiến nhất thì đấy sẽ được tổ hợp, được sử dụng để mà dùng trong cái việc mà điều trị. Và bên cạnh đó là nói về vấn đề về chi phí ấy, thì chi phí đây thì thường là cố gắng sẽ giữ thấp nó, và cộng thêm với việc là quý vị có bảo hiểm nữa thì nó sẽ giúp trang trải khoản chi phí này cho cái việc điều trị trong những lĩnh vực này.
So, Doctor, I have a follow-up to Tan's question, and you mentioned something about multidisciplinary approach to treating patients. Can you expand on that? I know sometimes our clients, we handle personal injury cases, and our clients will oftentimes go to their primary care doctor, who will then refer them to an orthopedic physician, who then refers our clients to physical therapy. How does your practice fit into that puzzle, and can people, while they're also seeing those treaters, come to your office as well for additional treatment?
Yeah, excellent question. Yeah, they can most definitely come see us at any point in that treatment algorithm. We actually tell our patients that the earlier that they come to see us, the better, and that has to do with pain, if treated early, before it sets up within the central nervous system, is much easier to treat. So if pain persists, what happens is that the nerves in the central nervous system can actually rewire on a somewhat permanent basis. And that can help to propagate this pain, keep this pain kind of constantly moving. So even if you, for example, get a knee injury or a back injury and that gets fixed from an orthopedic perspective, well, you see tons of patients, they still continue with pain. And a lot of that has to do with the fact that they didn't receive adequate pain treatment early enough. And really that's where we kind of come in, and we say to people, do the physical therapy. We love physical therapy. It's great for people. We firmly believe in it. But a lot of times there are treatments that we can render in addition to physical therapy that can really help to get people over that hump. In many ways, for example, if somebody comes in with a herniated disc, physical therapy is an excellent treatment for a herniated disc, but you may need some type of procedure to also help to reduce that pain, reduce that inflammation and swelling. Something such as a simple procedure such as an epidural steroid injection can be extremely helpful in these patients. It can reduce the inflammation. It can reduce that constant pain signal emanating from that disc. And when you get rid of that pain signal, it stops this problem where the central nervous system can get too overexcited, if you will. And then they don't tend to develop or lead into chronic pain as frequently. In addition to that, treating the pain also just makes the physical therapy more effective. They're able to move more easily. They're able to engage in physical therapy more easily. We find that the results from the therapy gets much easier. So that's really how we can slot in and be helpful in terms of treatment. You would want to see us really, I would say at any point in the treatment algorithm, but sort of the earlier the better, like I said, to really get pain control early is key in helping to avoid the progression of chronic pain in patients. And I think you'd asked about multidisciplinary. What that really means is that you use a multi-pronged approach to pain management, where you're not just reliant on doing injections or medications, but you're using those appropriately on patients that need them, but then you're also incorporating other aspects that we know work. For example, physical therapy, which is highly effective. There are biofeedback type of techniques that can also be helpful. Cognitive behavioral therapy, things like that can be helpful. Using a multidisciplinary approach to pain management generally tends to be the most effective, and we like to employ all of those techniques under one roof at our clinic. I think that's what really makes us special and sort of separates us from a lot of the other pain groups out there.
Thì thưa quý vị, bác sĩ vừa đề cập thêm một cái vấn đề là khi mà mình bị những vấn đề mà xương cốt thì gì đấy, mặc dù không liên quan lắm đến cái hệ thần kinh, thì hệ thần kinh là thường là nó về cái xương sống, quý vị, là cái spine ấy. Nhưng mà quý vị có bị đau đầu gối hay là đau gì đấy, những cái điều đấy, lệch đĩa đệm chẳng hạn, nó tác động lên dây thần kinh, ảnh hưởng đến toàn bộ cục diện trên hệ thần kinh trung ương, cả cái cơ thể. Thì trong trường hợp như vậy thì khi mình phát hiện ra mình bị bệnh thì nặng nhẹ thôi, mình cũng cần nên đi khám kỹ lưỡng, tại vì nhiều khi một cái bị nhỏ như vậy nó sẽ ảnh hưởng đến cái cục diện toàn bộ. Bị lệch đĩa đệm thì nó sẽ ảnh hưởng đến cái hệ thần kinh toàn thân mình. Cho nên là cái mà quan trọng nhất đây vẫn là mình nên đi cẩn trọng và nên ấy hơn trong những cái vấn đề mà điều trị những vết thương dù nó nhỏ thôi, nhưng mà vẫn nên cần sự chăm sóc kỹ.
So my next question is, what area do you specialize in, and then what areas does your facility, Premier Pain and Spine, specialize in general?
Yeah. So we can treat pain from really any part of the body. I would say that the majority of people that we see, though, they have some type of spine issue. So issues with their neck or their low back are some of the primary reasons that we see people for. We also treat a lot of joint pain, so knee issues, hip issues, shoulder issues, elbow, all types of orthopedic issues. I would say those two are probably the main kind of categories of patients that we treat. We also treat a lot, and those I would say are patients that may be on the more acute side, that more recently got injured and an injury at work, and they've herniated a disc, or they've fallen and they've hurt their knee. We also treat a significant amount of patients that have developed chronic pain. So again, these were patients that maybe did not get aggressive pain management treatment early enough. They've moved on to, unfortunately, the development of chronic pain. So they're okay from the surgical standpoint. The surgeon looks at their surgery, the fusion is fine, or the knee replacement looks good, but yet they continue to suffer, debilitating pain symptoms. They can't work, they can't walk, things like that. We treat quite a few patients like that. And we always tell people in that situation, like, look, this is not the end of the road. There are tons of treatment options for you. We have a high success rate helping people that come to our office with symptoms like that. Everything from simple things such as physical therapy type that they may not have tried in the past, to advanced spinal cord stimulation techniques, which is a newer device where we implant wires outside the spinal cord that helps to reduce or even eliminate that chronic pain that people feel from an old back injury or a knee injury or something of that nature. So I would say that's sort of the main groups of people that we see coming into the office. But no matter what, I mean, we really treat every type of pain condition under the sun. I mean, everything from headache, so migraine headache, all the way down to foot injuries, Achilles injuries, things like that. So from the whole top of the head to the bottom of the feet, any type of chronic pain or acute pain people have, we can handle it.
Thưa quý vị, câu hỏi của đặt ra cho bác sĩ ở đây là những cái mà về lĩnh vực điều trị bị thương ấy, vết thương ấy, điều trị đau nhức thì những lĩnh vực nào mà bệnh viện chuyên biệt làm, thì đây là có thể về bệnh đau nhức khớp này, đau nhức xương, đau nhức đầu gối này, đau nhức vai, về cơ và quan trọng là về xương. Thì đấy là những cái lĩnh vực toàn bộ cơ thể, là lĩnh vực mà bệnh viện đây là họ specialize. Và ngoài đấy ra thì còn có những cái thiết bị, những cái dụng cụ y tế, những cái thiết bị mà công nghệ cao có thể sử dụng trong cái việc mà điều trị những cái loại đau nhức này nữa. Bác sĩ vừa đưa ra một ví dụ như một loại thiết bị gắn vào xương sống của quý vị để mà giảm bớt cái áp lực, giảm bớt cái ấy lên toàn cái khung xương. Thì đấy là một cái ví dụ. Cho nên là bệnh viện này, thành xin nhắc lại, là bệnh viện của bác sĩ này là chuyên về điều trị đau nhức và những cái vấn đề về đau đầu gối, đau vai, đau xương, rồi đau khớp này nọ. Thì đấy là những cái mà bệnh viện chuyên làm.
Doctor, you've mentioned spinal cord simulator, injections, procedures. These sound expensive. What insurance do you take, and what do you do if a patient does not have insurance?
Yeah, so the good thing is that all these procedures are covered by insurance. So Medicare, Blue Cross, Aetna, all these procedures are covered. So in general, it's the same as any type of doctor visit. So that's makes it very easy. These procedures are very accessible for people to receive, and insurance pays for them just like they pay for anything else. If people don't have insurance, I mean, we work with them. I mean, we're never going to leave people hanging out to dry. Somebody comes in with chronic pain and significant pain issues. We work with patients all the time that don't have insurance or are underinsured. And at the end of the day, our goal is we just want to help people. So if we understand that sometimes even a simple procedure can be expensive. It can really put a significant burden on somebody. But if they get that one procedure, it allows them to go back to work and re-engage with their life, and that's important to us. And we'll do whatever we can in our power to work with people to make sure that they can get the type of treatment that they need.
A lot of our personal injury clients are hesitant at first to get treatment they need because of the cost. But exactly like you said, we urge them, get the treatment that you need, complete the treatment as instructed by your doctor, and then some physicians will lien the file, so our firm will handle the bills. But especially if you have insurance, people should not hesitate to get treatment that they need.
Yes, that's correct.
Thưa quý vị, câu hỏi vừa đặt ra cho bác sĩ ở đây là những cái bảo hiểm nào mà công ty bệnh viện của bác sĩ chấp nhận, và nếu như trường hợp mà không có bảo hiểm thì sẽ như thế nào. Thì đây là một cái trường hợp mà nó bình thường, nó rất là phổ biến ở Mỹ. Thì khi quý vị đi khám ấy, thì quý vị cần phải có bảo hiểm y tế này. Thì bệnh viện của bác sĩ là standard thôi, họ chấp nhận những cái loại bảo hiểm thông thường nhất mà quý vị thường thấy, như là bảo hiểm Aetna, rồi những cái bảo hiểm mà nó thông dụng. Bên cạnh đấy thì nếu như quý vị không có bảo hiểm ấy thì bệnh viện vẫn sẽ làm việc và sẽ điều trị cho quý vị, và không phải là không có bảo hiểm thì không được làm gì hết. Rồi thì đấy là câu hỏi tiếp theo của Thành, là tại sao cái điều trị mà về đau nhức này lại quan trọng, mà nó cái tầm quan trọng của nó là gì? So I have a question for you. What is pain management and why is it so important?
Sure. The field of pain management is the treatment of acute and chronic pain. When I first started, I don't think that we really understood a lot about pain management. We felt that it was, unless you had an injury that was immediately visible, well, why would people have chronic pain? And our understanding of the field over even the last decade has come so far. We know that chronic pain, especially chronic low back pain, is the leading cause for disability in our country. It costs our country billions of dollars per year, leads to so much time off from work and time lost from family. It's a debilitating condition, and it's sad because maybe pain won't necessarily lead to death, but it really causes such an impact on people's lives that it can really make every aspect of life so difficult. So I think that the awareness about chronic pain has come a long way. I think people are much more open to going out and getting treatment about it now, and to us those are all excellent things. The more people are aware and the more they come out and get treatment, then that's what really allows us to finally get out and use our toolbox to help these people. So chronic pain, kind of getting back to your question, is defined as pain that generally tends to last for more than 3 months. Again, we don't want people to get to that point, which is why we sort of advocate for earlier treatment of pain. If pain has been around for 3 months, we would say definitely, go see somebody who specializes in pain management, because at that point, something needs to be done. It's unlikely that it's just going to start to go away on its own. Prior to that, if your patients are noticing that this pain is lingering, it's not improving the way that it should, we would encourage them to see a pain management physician, because, that's indicating to them that there's something going on that the body can't handle on its own. And sometimes the body just needs a little bit of help to get over that hump and fix whatever is going wrong. And people really know their bodies the best. If a patient has an injury, and typically, they may have a history of throwing their back out, gets better usually within a week, but this one's lingering, it's lasting for 3 to 4 weeks, off some injury. They know that this is different from their normal situation, and that I need to do something a little bit more aggressive about it. So we would encourage those patients to definitely come in and seek care from a pain management physician at that point, to again ensure that the pain doesn't develop into a chronic pain type of picture.
Thì câu hỏi mà Thành vừa đặt ra cho bác sĩ ở đây là cái tại sao cái điều trị mà về đau nhức ấy, thì nó là rất là quan trọng. Và tại vì khi mà quý vị bị đau nhức ấy, nó có thường là những cái dấu hiệu, những cái bệnh mà nó nghiêm trọng hơn sau này, ví dụ bị đau nhức xương, đau nhức về khớp, đau nhức về vai. Đấy là những cái dấu hiệu mà khi mình tuổi tác mình nhiều ấy, mình cao hơn, thì nó sẽ là cái, ngoài những cái mặc dù với ban đầu thì nó nhỏ thôi, nhưng mà đó là một cái dấu hiệu, một cái vấn đề rất lớn hơn. Thì khi mà mình phát hiện ra mình điều trị sớm, thưa quý vị, đấy là một cái mà phòng ngừa những cái rủi ro, những cái khả năng mà những cái căn bệnh mà nó nghiêm trọng hơn xảy ra trong tương lai. Bởi vậy cái rất là quan trọng khi mà quý vị biết là điều trị sớm và nghiêm túc hơn đối với những cái dấu hiệu, những cái căn bệnh mà bị đau nhức về trong cơ thể con người như vậy.
So, Doctor, you've described some of the services offered at Premier Pain and Spine. In general, I was wondering if you could discuss a handful of them in more detail, what they entail, and how these services go about treating your patients.
Sure. So, for example, one of the more chronic, or one of the most common things that we see at our clinic is back pain, so low back pain. It helps to sort of look at why are they developing that back pain to begin with. So, when you come see us at our clinic, we're going to go over all your old medical records, including notes from other doctors if those are present. We'll look at your old MRI results. If they're too old, we may opt to order another MRI to get some up-to-date pictures as to what's happening. So based on all that, we'll take all that information and come up with an accurate diagnosis as to what is actually causing that pain for you. Typically, we see for low back pain patients that the primary causes of back pain in them would be a herniated disc. That's one of the primary causes. Another primary cause is arthritis in the low back and the facet joints. And the third primary cause is something called sacroiliac joint disease, or sacroiliitis. All three of those areas of the body require separate treatment. So it's extremely important in the beginning to nail down an appropriate and accurate diagnosis. And I think that's really one thing that separates us from a lot of other clinics out there, is that we put a lot of time and effort into that initial portion of the visit, because we don't want to sit there and do multiple procedures on people that aren't going to work, trying to pin down the cause of their problem. We want to get it right from the first time, so we spend a significant amount of time making sure that we have the correct diagnosis up front. If, for example, we do go through everything and we see that, okay, it looks like a herniated disc is most likely what's causing your pain, we would do a simple procedure called an epidural steroid injection, which involves taking a very small needle and using an X-ray machine. And under X-ray guidance, we advance that needle to around where that disc is bulging, and we inject a little bit of steroid medication around that disc, and that helps to reduce significantly the inflammation and swelling associated with that disc. Oftentimes, a disc is pressing on a nerve, hence why patients may feel pain shooting down their leg. So that treatment can also alleviate any type of shooting pain or sciatica type of pain that they may be feeling from that herniated disc. If we do our homework and find that, well, it's actually the back arthritis in the facet joint that's causing the pain, there's not really no evidence of a herniated disc. then we may opt for a completely different type of procedure called a facet joint injection, which is, again, we take a small needle, but instead of advancing it near the disc, we advance it under X-ray guidance into a very small joint, just running along the sides of the spine. And these joints allow our spines to move, to rotate, bend, forward and backwards, and they can develop arthritis within them just like any other joint in our body. So our goal in that procedure is we inject a very tiny amount of steroid and local anesthetic into that arthritic joint next to the spine. If we do, again, go through the images and we see that, okay, it's actually the sacroiliac joint that's causing the pain, well, then it's, again, a completely different type of procedure. And again, we would use an X-ray machine to guide a very, very small needle into that joint space, injecting some steroid into there. So those are just 3 quick examples of some very common procedures that we do at our clinic. And, you know, those I would consider very simple. And we do more complex procedures. For example, if somebody fractures part of their spine, there's a procedure called a kyphoplasty where we can actually take some cement and inject it into the spine, helping to stabilize that joint or helping to stabilize that fracture. And that's a much more involved procedure. So there's a whole myriad of procedures that we can do. I think the important thing is to make sure that the diagnosis, though, from the start is correct, because that way you're getting the right procedure for the right condition. And that's really what's going to be the key here, is making sure that you get treated with the correct procedure, so that then you feel better much quicker, and also you're not having to go through multiple procedures that may not be effective.
Thì thưa quý vị, câu hỏi vừa đặt ra cho bác sĩ ở đây là những cái dịch vụ nào là cơ bản và những cái dịch vụ nào là nó chuyên sâu. Thì bác sĩ vừa đưa ra những cái ví dụ như là rất là chuyên sâu về y khoa, như là khi mà quý vị bị thường là những cái phổ biến mà bệnh nhân hay đến phòng khám để mà chữa là những cái bị đau nhức, cái đau lưng dưới về phía thấp của lưng. Thì đấy là một trong những cái bệnh thường phổ biến. Thì những cái điều trị, những cái phương pháp thì quý bác sĩ vừa ra một ví dụ như là có thể là trích vào đấy một cái lượng hóa chất gì đấy để mà nó điều hòa lại cái sự bền vững của cái xương. Và đấy và thêm một cái nữa là có thể can thiệp vào bằng y khoa như là mổ này, và trích thêm một loại thuốc điều trị để mà giúp cho xương nó lành, hoặc là nó khớp nó lành nhanh hơn. Thì đủ để thấy là cái mức độ mà nó về chuyên sâu, về những cái mà khoa học công nghệ cao thì đều được sử dụng để điều trị những vấn đề mà về xương khớp và đau nhức trên cơ thể con người.
Do you help people who have been injured on the job or in a personal injury accident?
Yes, so that's a pretty decent sized chunk of our patient population. We treat a lot of workman's comp and personal injury patients. You know, we understand that a lot of times if their injuries tend to be a little bit more acute. You know, maybe somebody just was injured, a few days before coming in to see us. And, you know, a lot of workup, you know, imaging, testing, things like that may not have been completed at the time, you know, and they're sort of wondering what's going on, you know. So, a lot of times they're kind of scared of the system or what's going to happen, and, you know, what's this mean for my job and, you know, my treatment and things like that. And, you know, we take our time, you know, we want people to know in that situation, assure them that, you know, we're going to do everything we can to, you know, help them, get them back to work and get back to the quality of life that they had before. We take our, initial meeting with them, and then we'll move forward from there and make sure that we cover all bases, you know, cross all our T's and dot all our I's, order all the appropriate testing, make sure that we figure out exactly what's going on and get them started down the right treatment algorithm from the beginning.
Thì thưa quý vị, phòng khám của bác sĩ điều trị những người mà bị thương tật khi đi làm thương tích cá nhân này, gây ra bởi những cái như là công việc, và hoặc là bị tai nạn xe cộ thì những cái đấy đều được bác sĩ phòng khám bác sĩ là nó xử lý những cái vấn đề như vậy, và như là khám bệnh này, chẩn đoán bệnh này và đưa ra những cái phương pháp mà điều trị phù hợp đối với căn bệnh đấy là bác sĩ đều phòng khám đều quan tâm và đều đi theo trình tự đúng trình tự để mà giải quyết những cái vấn đề mà bị thương tích như vậy. So how many pain management visits does insurance usually cover?
There's really not too much of a limit if you're talking about so just a standard office visit. It's like any type of other office visit, and there's really there's no limit on that. For the procedures, depending on what type of procedure it is that you're requiring, those may be limited to 6 to 8 per calendar year. But we usually find that the limits are generally pretty generous. We don't really run into problems with that. Usually we can treat and get people feeling better kind of under the limit that most insurance companies set for the number of visits. But again, just to see us, to discuss options or maybe adjust medications or see how the physical therapy is going and things like that, there's no limit to the number of visits you can have.
Thì thưa quý vị, câu Thành vừa đặt ra cho bác sĩ ở đây là những cái khi mà mình đi khám bác sĩ như vậy thì mình bảo hiểm ấy thường là cover bao nhiêu lần, thì cái này là thường là 6 đến 8 lần, nhưng mà cũng tùy thôi quý vị, tùy cái trường hợp và tùy vào cái bảo hiểm mà quý vị mua, có thể nhiều hơn, có thể ít hơn, nhưng mà thường ấy là từ 6 đến 8 lần.
Doctor, could you tell us what a soft tissue injury is, and do you oftentimes see soft tissue injuries as a result of car accidents?
Yes, so that is very, very common in car accidents to see soft tissue injury. In general, soft tissue injury is considered injury that's not part of the bony skeleton. So it could involve tendons, ligaments, or even the muscles themselves. So I'd say a good example of that is somebody who's just been in a car accident. And, let's say they get, hit by somebody from the rear, and it causes a whiplash injury. So their head moves forward and back very quickly. We see a lot of people develop neck pain from that, very, very significant neck pain. And you'll get in maybe some detailed imaging of the neck, such as an MRI, and everything looks good as far as the discs and the bones are concerned. Nothing's broken. They don't have a slipped disc. There's no pressure on the nerves or anything like that. But you'll see on the MRI that there's a lot of spasm or constant tightening of the neck muscles. And that clues us in that there's a soft tissue injury, because that tends to be what happens when muscles get injured. They tend to tighten and they tend to spasm. So we see these types of soft tissue injuries a lot in patients who've had, a whiplash injury like this. And treatments for it are very effective. And what we would do is get somebody started in physical therapy and maybe put them on some type of muscle relaxer to start to reduce some of that spasm. But one of the most effective treatments that we do are called trigger point injections under ultrasound guidance, where we actually use a machine, an ultrasound machine, and we're able to physically visualize where that muscle is injured, where it's spasming. When we see that area on our monitor, we inject a very small amount of steroid and local anesthetic, and it helps to reduce the inflammation, the swelling, and the spasm associated with that soft tissue injury. So yes, it's very common. Oftentimes it is misdiagnosed as a non-soft tissue injury. And we see that, a lot of patients needlessly suffering from soft tissue injury for a prolonged period of time because it wasn't treated appropriately from the start. But once they do receive appropriate treatment, it tends to respond very well.
Thưa quý vị, câu hỏi vừa đặt ra cho bác sĩ ở đây là những cái mà chấn thương mà về mô mềm là gì, và những cái chấn thương vậy mô mềm nó có phổ biến khi mà bị tai nạn xe cộ hay không. Thì chấn thương về mô mềm hay là những cái chấn thương mà nó không bị vào sâu bên trong, như là bị xương và bị khớp. Chấn thương mô mềm mà thường là ở da hoặc là bị cơ bên ngoài Thì những cái chấn thương như vậy thì bệnh viện, phòng khám của bác sĩ là người ta cũng xử lý những vấn đề đấy luôn. Thường là chúng ta sẽ trích vào một lượng nhỏ thuốc kháng sinh hoặc là thuốc steroid để mà giúp cho cái vết thương đấy nó không bị phồng lên, không bị sưng lên. Đấy cũng là một trong những cái mà phổ biến, những cái chữa chuyên môn phổ biến cho đến từ phòng khám này là về những cái điều trị mô mềm ngoài da hoặc là ngoài cơ.
You've already touched on this a bit, but how does pain management treatment help soft tissue injuries?
Yeah, so it's we employ. I would say again, we employ a real multidisciplinary approach to soft tissue injury. And unfortunately, untreated soft tissue injury can lead to chronic pain, just like anything else can. So if it's sort of left untreated or undiagnosed for a longer period of time, over 3 months, we see it becoming a real chronic issue for people that then becomes quite difficult to treat. So our approach to soft tissue injury is to sort of be a little bit more aggressive with it up front. So if we see somebody who with clear soft tissue injury, they have not done physical therapy, or let's say they've done inappropriate physical therapy, for example, physical therapy that was not geared towards the soft tissue portion of it. Maybe they've been misdiagnosed as having a problem with their spine and their therapy was geared more towards the spine. Well, that's not necessarily going to help the soft tissue portion of the injury. So we would get that person back into therapy that's more appropriate and targeted towards that soft tissue injury. There are certain types of medications that can be very helpful for soft tissue injury. A lot of these are non-opiate, they're not addictive, they're not habit forming. So we always like to avoid those types of medications in people if at all possible. A lot of these are topical formulations that are easy to apply, that work just in the area that you put them. So we tend to lean on medications like that. And then from a procedural standpoint, we would rely on treatments such as these trigger point injections, and where we would again use the ultrasound machine to guide the needle exactly into the area where the soft tissue injury is located, and put a small amount of treatment medication down in that area. So I would say that's the general approach to treating soft tissue injury at our clinic, and again, it's it all comes down to diagnosis. Making sure that it's diagnosed appropriately from the start is really the key here, so that people are getting the appropriate treatment from the very beginning. That's when people tend to have the best outcomes.
And if a patient is undergoing physical therapy treatment, they're still experiencing continuous pain, at what point do they contact you or a pain management doctor? When do they make that decision?
We actually encourage people to see us, again, as early as possible. But if they're having pain during physical therapy, they shouldn't hesitate. They don't need to complete the treatment of therapy first and then call us. If they're having pain during therapy, they should call. We should treat. That'll help to reduce their pain. It's going to make the therapy so much more effective too, if we're able to do that. So we work pretty closely with different groups of physical therapists, where we'll actually provide treatment, possibly, let's say, for example, a trigger point injection, and then they'll go to physical therapy right after we do our procedure. And then the therapist is able to get much better range of motion. The patient's able to do a lot more during therapy, push themselves, because a lot of therapy is sort of getting past like a wall that you may have, and sort of breaking past that in small increments, right? You go 5% more on Monday, then 5% more on Wednesday, then 5% more on Friday. And then if we are able to sort of alleviate the pain before you go into therapy, it makes it much easier for patients to do that. I think that's a very positive effect on patients too. It acts as a positive reinforcement that they're really doing well and making good progress in their physical therapy. So most people that we see in our clinics that are coming to see us for a pain management standpoint, they tend to see us before they've even done physical therapy. So the majority of the patients that see us haven't done any physical therapy at that point. we tend to be, I'd almost consider us gatekeepers, where, you would get some type of injury, whether that's chronic or acute, and, really we should be the first people that you see. You come in, you see us, we order the appropriate testing, get the appropriate referrals made. I mean, if it requires an orthopedic referral or a neurosurgical referral, we'll do that right away. If it doesn't require that, then we can stick to physical therapy, maybe some of the procedures that we do to help treat people. But again, the earlier people come in to see us, the better.
Rồi, thưa quý vị, câu hỏi vừa đặt ra cho bác sĩ ở đây là tại vì cái việc mà điều trị về vết bị đau nhức ấy, tại sao nó lại quan trọng để mà cho những cái vấn đề mà bị mô mềm, những cái vết thương mềm như vậy, thì bác sĩ vừa đề cập những vấn đề là khi mà chúng ta tìm hiểu chúng ta về chẩn đoán cái bệnh thì càng sớm ấy, thì cái khả năng và cái bệnh đấy, cái quá trình điều trị ấy, nó sẽ hiệu quả hơn rất là nhiều lần so với việc là quý vị khi mà phát hiện mình bị đau nhức khớp, đau nhức lưng hay là bị những cái mô mềm gì đấy mà chúng ta chờ lâu, chúng ta không có những cái biện pháp hiệu quả, hoặc là chúng ta thiếu được cái bỏ đi cái cải thiện chức năng, phục hồi chức năng sau cái quá trình điều trị, thì nó cũng là một cái bước mà nó quan trọng trong cả một cái quá trình như thế này. Thì mình phải, bác sĩ bệnh viện phòng khám là những cái nơi mà họ tư vấn cho quý vị một cách tốt nhất, cách mà đi từ bài bản như thế nào để mà điều trị mà có hiệu quả nhất, là chẩn đoán để điều trị và cuối cùng là phục hồi chức năng. Right. So does PPS also treat patients based on Lion?
On lean?
Lion, yes. I'm sorry.
Oh, no problem. Yes, we do. We treat patients based on lean.
Right. Thì Thành vừa hỏi là quý vị cái phòng khám này có chữa bệnh nhân mà trong trường hợp mà không có bảo hiểm không, thì câu trả lời là có của bác sĩ.
Yeah, and Tan, I think what's important for the viewers to know about doctors who are willing to treat patients on a lean, for example, if you're involved in a car accident and you need medical treatment and you're concerned about the medical bills and who's going to pay for them, what doctors will do is provide the treatment, and then rather than send the client or the patient a bill, they would send our office a bill, and then when it comes time to settle the case with the at-fault driver, the insurance company, we would use those settlement funds to pay any type of doctor bills, which is essentially what a lien is. So it's important for the viewers to know that whether you have insurance or not, or whether you're concerned about medical bills, it's good to know that the folks at Premier Pain and Spine will work with various insurance companies, and they will also lien any type of file, which means the clients don't pay, and it would just come out of the settlement funds, because people are always concerned after car accidents or any type of personal injury, who's going to pay all these bills. And so it's good to know that Premier Pain and Spine will do that, send us the bill, and we'll take care of it at the end from the settlement proceeds.
Okay. Thưa quý vị, luật sư Michael vừa thêm nữa là cái lien ở đây nghĩa là trong trường hợp quý vị không có khả năng trả nợ thì bệnh viện phòng khám vẫn làm việc và vẫn làm việc với bảo hiểm này. Nếu như không có bảo hiểm thì quý vị làm việc với một cái quỹ gì đấy để mà mình dàn xếp, mình thỏa đáng cái chi phí cuối cùng. Cho nên là quý vị không lo những vấn đề đấy. Về quý vị mà có bảo hiểm hay không có bảo hiểm ấy, thì vẫn được điều trị. Còn lại chi phí thì mình sẽ làm việc sau cái quá trình điều trị đấy.
So, Doctor, we have a couple more questions for you, and this one is some advice that you can give. So, initially, I was going to ask you what's the best advice you give your patients, but I also think it's important if you could also give some advice to maybe people who are viewing or watching this show who aren't yet your patients or haven't seen a pain management doctor. You know, what type of advice do you give people who are experiencing chronic pain at home, who haven't seen a pain management doctor, and then what's your best advice when patients do make it to you and they walk in the door? What do you tell them?
Yeah, I mean, my best advice I could say is, is don't hesitate to seek treatment. We see a lot of people that, they've gone on with their pain for so long that it just becomes a normal part of their life. And I don't think they realize until after they receive treatment, what a huge impact that pain had been having on their quality of life. I mean, people are resilient, that if they have a chronic hip issue or a knee issue or a back issue, they find ways to work around it. I mean, they'll modulate the way, they get out of the car, or they won't engage in a certain activity that they used to like because they know that's going to aggravate their pain. They won't pick up their kids. They won't go for runs anymore, even though they used to love doing those types of things. So, they learn to live with it, but I don't think they realize really how much they've had to compromise until they finally come in and receive treatment. They say, wow, I just didn't realize how much this had been impacting my life, how I, just had, just kind of adjusted my life to live with this pain. And we tell people that you shouldn't have to do that you don't have to change the whole way you live just to deal with this pain. Let's deal with the pain and get you back to the life that you want to live. And that's really what I would tell our viewers. Small example, but we treat a lot of migraine, headache as well. And one of the treatments that we render for that is Botox. And I had a patient the other day who, she didn't really feel that the migraines were that big of an impact. We did the Botox treatment, and she's been completely headache free for 3 months now, no migraines. And she told me the other day in clinic that she hasn't felt this way in 20 years. She didn't realize what a huge impact it had on her life. That with the migraines, she was snapping at her kids and short-tempered and just going to sleep early all the time. And now she has a completely different perspective on life. And she was just very grateful for that, and it was really satisfying to hear from my perspective that we could make such a change in a person's life. So I would say that would be my main advice is don't hesitate. See, even if you've been told in the past that there's no effective treatment, there's always something that a new set of eyes can see differently, and some treatment that can be rendered that can be helpful for people. So that's really, I'd say, the advice that I give to most of the people listening that are kind of on the fence or wondering, if they should receive treatment or not.
Thì câu hỏi vừa đặt ra cho bác sĩ là có lời khuyên nào cho đến với những bệnh nhân mà liên quan đến những cái vấn đề mà bị đau nhức về cơ thể người. Thì bác sĩ nói là chúng ta luôn cần phải quan tâm đến sức khỏe này, cần phải như có vấn đề gì đấy thì luôn luôn đến bệnh viện, đến phòng khám để được những cái tư vấn. Những cái bác sĩ chuyên môn ấy, người ta luôn luôn có những cái giải pháp tối ưu nhất cho quý vị để mà điều trị được cái vết thương, những cái đau nhức trên cơ thể của người, như là bị đau nhức khớp gối này, đau nhức về lưng, đau nhức về vai. Thì mặc dù mà mình nghĩ là không có thuốc đâu hay gì đấy, nhưng mà phòng khám bây giờ công nghệ hiện đại luôn luôn sẽ có những cái phương pháp điều trị tốt nhất cho quý vị, thì quý vị không lo về những cái khoản đấy.
If someone is struggling with pain management, what is the best way to schedule an initial evaluation or appointment at Premier Pain and Spine?
Sure. So there's multiple channels people can use to schedule appointments with us. There's right on our website, patients can do a quick form fill. It takes about 10 seconds with some of their contact information, and that gets sent to our staff immediately for somebody to call them back to get them scheduled. They can always call. Our phone number is again on our website. 847-519-4701 is the main number. And they can get patched through to our scheduling line. We always have somebody on that line during normal business hours. So those are probably the two best ways to get in touch with our clinic, would be through the form fill or calling our main number. There's email address as well on our website. So if patients aren't comfortable with those first two options, email, we always check it, they're always returned. So if people want to schedule just by sending a simple email, that's fine as well.
Rồi, thì thưa quý vị, câu hỏi vừa đặt ra đây là những cái cách nào mà mình thực hiện, những quy trình nào để mà mình lên một cái schedule, cho một cái lên lịch khám ở bệnh viện. Thì bác sĩ vừa nêu ra, chúng tôi đến điền đơn, làm đơn thì mất tầm vài giây thôi, hoặc là có số điện thoại của bệnh viện và trên đấy nữa chúng tôi có cả email. Và xin quý vị thì những vấn đề này thì liên lạc của chúng tôi, số điện thoại là 773 906 999. Thì anh Quý Ngọc chúng tôi có rất nhiều luật sư và rất nhiều những cái mối quan hệ, những cái bệnh viện, những bác sĩ ở đây, và họ sẽ là người giúp quý vị nếu quý vị có bất kỳ lý do, bất kỳ những cái khó khăn nào về mặt pháp lý, về mặt sức khỏe thì hãy liên lạc cho anh Quý Ngọc thông qua đài. Rồi, và đây cũng là chương trình ngày hôm nay, là khép lại ngày bây giờ. Chủ đề là những về thương tích, về cá nhân, thương tích về bị trên cơ thể người. Thì quý vị nào có câu hỏi thêm thì xin vui lòng gọi đến đài hoặc là comment trên trang Facebook của chúng tôi là VSE 1040. Chúng tôi sẽ giải đáp hết những câu hỏi đấy. Rồi, thanks Michael, Taylor, and thanks Doctor for joining the show today. Really appreciate your participation.
Thanks for having us on. Yeah, thanks, Doctor. We appreciate it.
Thank you.
Thank you.
Xin gặp lại quý vị trong chương trình tuần sau của đài.